All right, we are still in chapter 17, and this is on hemostasis. So what hemostasis is it's just a fast series of reactions for stopping bleeding. It requires clotting factors and substances released by platelets and injured tissues, and we're going to talk about all this stuff. Lots of stuff involved. And it actually involves 3 steps. Step 1 is vascular spasm. Step 2 is platelet plug formation. Step 3 is coagulation or blood clotting. So the first thing that happens is vascular spasm. The vessel itself responds to injury by vasoconstricting. So what that means is that the diameter of the blood vessel actually gets smaller. Vascular spasms are triggered by a number of things, including direct injury to the smooth muscle of the vessel, chemicals released by endothelial cells and platelets, and pain reflexes. Now, vascular spasms are going to be most effective in smaller blood vessels, but they can significantly reduce the blood flow until other mechanisms kick in. Step 2, platelet plug formation. So the first 2 steps are actually pretty quick, right? Step 1 was just 1 page, step 2 is 2 pages, step 3 is more than that. But anyway, step 2, platelet plug formation. We have platelets stick to collagen fibers that are exposed when the vessel is damaged. So vessel becomes damaged, the collagen fibers are sticking out, and platelets will adhere to them. Under normal circumstances, platelets do not stick to intact vessels because of the fact that collagen is not exposed. In addition, there are 2 things secreted by endothelial cells that actually prevent platelets from sticking, and those 2 things are prostacyclins and nitric oxide. And then von Willebrand factor helps to stabilize platelet collagen adhesion. Now, when a platelet is activated, it will swell, become spiky and sticky, and release a number of chemical messengers. The first one is ADP, and this is going to cause more platelets to stick and release their contents. In addition, serotonin and thromboxane A2 will enhance vascular spasm and platelet aggregation. So maybe you could see by reading this, when it says ADP causes more platelets to stick and release their contents, that this is a positive feedback cycle. As more platelets stick, they release more chemicals, which attract more platelets to stick, which are going to cause more chemicals to be released, which are going to cause more platelets to stick, and so on and so forth. Platelet plugs are good for small vessel tears, but larger breaks in vessels do need an additional step, and that additional step is coagulation. And this is a much longer step. And coagulation or blood clotting will reinforce platelet plug with fibrin threads. So we're going to talk about where the fibrin comes in later. But first, blood clots are effective in sealing larger vessel breaks. And what happens is the blood actually gets transformed from a liquid to a gel. And there are a number of clotting factors that are involved, mostly plasma proteins, and you can see they're numbered from 1 to 13. And then vitamin K is needed to synthesize 4 of the factors. And coagulation itself occurs in 3 phases. I'm just going to tell you guys, straight up in this video, that I am actually strongly considering this as one of the essay questions. So again, just as a little review before we continue on with coagulation, we have vascular spasm, so smooth muscle contracts, causing vasoconstriction. Platelet plug formation, so platelets adhere, they release their chemicals, attracting more platelets to cause them to adhere, to release their chemicals. And then finally coagulation, which is going to involve fibrin, and we will continue on. So phase 1. So phase 1, what you're trying to do is get to something called prothrombin activator. And there are 2 different ways to get there. You can get there by the intrinsic or the extrinsic pathway, usually both though. They're triggered by tissue damaging events, involve a series of procoagulants, and each of them is cascading towards the activation of something called factor X. Factor X is then going to complex with calcium and platelet factor 3 and factor 5 to form prothrombin activator. So again, phase 1, the purpose is to get to prothrombin activator. Now, there are some differences between the two pathways, okay? So the intrinsic pathway is called the intrinsic pathway because all the clotting factors are present within the blood. The extrinsic pathway is called the extrinsic because factors needed for clotting are located outside of blood. The interesting thing is that the extrinsic pathway actually bypasses several steps of the intrinsic pathway, so it is a faster pathway. And this is where you can see the intrinsic is going through all these additional steps, right? And the extrinsic pathway does not go through that many steps. All right, pathway to thrombin. So remember, we were trying to get your prothrombin activator for phase 1. So now we're in phase 2, and prothrombin activator is going to catalyze the transformation of prothrombin to active enzyme thrombin. That's it. That's phase 2. Pretty simple, right? Phase 3, common pathway to the fibrin mesh. So thrombin converts soluble fibrinogen to fibrin, and then the fibrin strands form the structural basis of the clot. And what happens is the fibrin is actually going to cause the plasma to become gel-like, which will trap the formed elements. And then thrombin, along with calcium, will activate factor 8, which is then going to cross-link the fibrin, which will strengthen and stabilize the clot. And then here we just mention anticoagulants because under normal circumstances, which these would not be normal circumstances, but under normal circumstances, we would have anticoagulants dominating in the blood, and anticoagulants are going to inhibit coagulation because under normal circumstances, we do not want to form blood clots. Yeah, and this is just showing we're going from fibrinogen to fibrin and then cross-linked fibrin mesh. And so this is just showing from phase 1 all the way down to phase 2 and then phase 3. So again, with the extrinsic pathway, it's going to be less steps, but it doesn't matter. You're trying to get to a prothrombin activator, and then we're going to convert prothrombin to thrombin, and then we're going to come in here with fibrinogen, and then we have fibrin, and then we're going to cross-link it, and we're going to form a nice clot. And that's what we're seeing here, a scanning electron micrograph of erythrocytes trapped in a fibrin mesh. Clot retraction, the clot must be stabilized and removed when damage has been repaired. So what happens here is in the platelets, there's actin and myosin, and it'll begin to contract within 30 to 60 minutes. The contraction pulls on those fibrin strands, and it literally draws the ruptured blood vessel edges together. Vessel is healing even as clot retraction occurs. We have something called platelet-derived growth factor. This is released by platelets, and this is going to stimulate a couple things: the division of smooth muscle cells, because a lot of our vessels do have smooth muscle, and then fibroblasts to help rebuild blood vessel walls. And then VEGF, which is vascular endothelial growth factor, will stimulate endothelial cells to multiply and restore endothelial lining. And then fibrinolysis, and this is just where clots are removed. And what happens is plasminogen is a plasma protein that's trapped in the clot. It's then converted to plasmin, and plasmin digests fibrin. And remember, the clot is made up of fibrin strands that are linked together. This is all I have for this talk. There are no questions for this one. There are questions for the next one, which will be a lot shorter.